Parkinson's, huh? So, well, what are my options?
Well, normally I wouldn't call this lucky, but you do have individuals in your family with Parkinson's disease already. Your father and grandfather, as we've discussed, have also been diagnosed with Parkinson's. What do you know about it, and what are your fears now, and how would you like to continue?
One of the things I know about it is that it affects men more than women. My granddad thought that was kind of a not too fair of a thing, but besides that, I don't really know much else.
Okay. Well, you're exactly right. Parkinson's does normally affect males more than women. It also only affects 1% of males over the age of 60. Very rarely do we see cases where individuals younger than 60 contract Parkinson's. But as you probably do know, it's unclear exactly what the etiology of PD is. We do understand what happens after you contract it and what happens going forward. But as far as how exactly you do get it, we're unsure despite some environmental factors and lifestyle. As you can see, it's also the second most prevalent neurodegenerative disorder after Alzheimer's. It does affect your nerve cells or neurons. This is part of the brain that controls muscle movement. In Parkinson's specifically, it's going to affect your dopamine levels, which will lead to the effects that you're noticing, more prevalence of falling, these tremors, and things like that. You'll be generally more and more unable to control your body movements, and you'll become tighter, and it'll be a little bit more difficult to just move around in general. What we're going to do today, I'm going to prescribe levodopa for you. It is the most common medication prescribed for Parkinson's disease, and there are some side effects with it. In general, levodopa can simply become less effective over time. So we can also stack that with talcopone and entacapone, shown here, which are COMT inhibitors, and these use enzymes to actually block the breakdown of levodopa over time. So that way we're going to get you as much help as possible through the medication realm, and equally I'm actually going to prescribe you an exercise program.
Now, what does exercise have to do with this disease? How can it help?
Well, overall it will simply improve your quality of life, as well as slowing the progression of the disease. It'll actually make you more effective at controlling your body and kind of inhibiting the side effects that we see from the medications as well. So what I would like you to do is start a yoga program. This will be 3 times per week for 1 hour. Some other things that you can do, swimming, boxing, anything that obviously will not increase the risk of you falling or injuring yourself, but will also increase movement and cardiovascular fitness for you.
I see. Okay.
Are there any in particular sports that you enjoy doing on your free time?
Well, I do like swimming. It's I like basketball, that sort of thing.
Okay, I would definitely recommend swimming on the off time, and otherwise we're just going to continue with the medication and exercise program.
All right. Sounds good.
All right. That was pretty bad, and